Mental health issues can be overwhelming to deal with, but where can people turn for immediate help? Good evening, I'm Marcella Lee.
I'm Carlo Cicchetto. We know that law enforcement often isn't the best option to respond to these kinds of problems, but there are professionals who are immediately accessible and ready to help. As
CBS 8's Kirsten Holmes explains, San Diego County's mobile crisis response team is specially equipped to deal with these intense situations.
I grew up in a family impacted by mental illness. Left unchecked and untreated, that can be tough for anyone to deal with. And historically, for some communities, there's just not that level of access to help. Until now, thanks to San Diego's mobile crisis response team. So I went with them for a ride along just to see how they can help.
Tell me about that. Who wants you dead?
At situations like this where San Diego's mobile care response team steps in.
Are you hungry?
She is currently pregnant and unsheltered. I was wondering if you guys had any resources we could utilize for her.
When people need help the most.
CRT3 out!
Brianna Lane is a program administrator for MCRT. She says as soon as they respond, it's their job to give the best level of immediate care possible.
What's happening? What's going on? What kind of led to this place? What do you need to help get out of this place? So the fear is that maybe, she has the potential to harm herself behind the door. We provide a immediate crisis response to someone who is off their baseline, experiencing a mental health or substance use crisis.
I'd like to eventually talk to the referring party.
After that, we will follow the individual for post 30 days from the intervention.
MCRT, this is Lauren.
MCRT's response team is made up of 3 people: a licensed clinician who is able to help in mental health crisis, a case manager who can help coordinate care after the call, and a peer specialist who has firsthand experience with these types of situations.
Because if they don't connect with one of us, there's a good chance they might connect with the other 2. For years, the default when someone is in a crisis of any sort has been going to the emergency room. That's been the easiest route. It's been the most known route. And, we're really trying to not clog up the ERs with inappropriate services that are needed. We try to do all of these lower levels of care before taking them to an emergency room.
Here's how it works. In San Diego County, if you need help, you call Access and Crisis to get a hold of the MCRT. But in Chula Vista and National City, they're already getting calls routed from 911 with hopes of expanding that integration countywide.
MCRT, this is Maddie. How can I help?
The team makes an assessment at their facility before loading up and heading out.
Are they an imminent risk to themselves or someone else? Is there a medical reason that they would need EMS services first? Do they have weapons on them? And if we clear all those criteria, then our team will accept the call, and then a mobile team will go out. You're gonna get on 8 East. So the oldest member we've served to date has been 91. The youngest we've served has been 7.
Because in times of crisis,
people would either just kind of sit and suffer because they're not sure where to go. And that step of asking for help is a huge step. Because law enforcement in general is just not trained the same as, mental health clinicians are trained. Oh, here, do you need one of these?
Brianna says every call can be seen as a success because
we were just able to make contact, meet him where he was at, and let him know that we're available.
Sometimes it takes a few contacts, to really plant that seed and get them motivated to actually pursue change. Sometimes it's not a home run, but it's a single, and it's all helping to build communities, right?
They're going to get you set up with transportation to be taken directly to your housing, okay?
And right now, they just want people to know that they are there when you need them.
We're in purple, we stand out, we look different, but just getting our name out in the community and seeing that we show up, we have snacks, we have a teddy bear.
We'll get you your medications there at the independent living home, okay?
Okay, all right, thank you. Bye, Roberto.
Stand out in a positive way where people would feel that we're approachable to come to if they needed help or questions.
Kirsten Holmes, CBS 8.
Thanks, Kirsten. The mobile crisis response team is provided as a service across San Diego County. It's their goal to be reached just by dialing 911 from anywhere in the county outside of National City and Chula Vista soon. But until then, you can call this number, and you might want to write it down if you know a family member who may be in mental health crisis or have a substance abuse problem. 888-724-7240. That's 888 724-7240. For more information or how to connect with them for care, you can visit our website, cbs8.com.